So now here I'm going to hop in. We're going to talk about the shift towards harm reduction. Again, I did an intro at the beginning, but for those who weren't here, I am the digital community organizer here at Dream.org. And I have a person who's used a lot of drugs and is deeply involved and love harm reduction with all my heart. Okay, so understanding what harm reduction is. So this may be a concept that you're familiar with, or it may be something that you've never heard about before. I'll give you the actual, like the definition, which is strategies aimed at minimizing the negative health, social, and legal impacts associated with drug use. So that's kind of like the formal definition. The true definition that is kind of acknowledged and used within circles of people who use drugs or sex workers or anyone who kind of falls under the harm reduction umbrella is really that at its core, it acknowledges that people are going to engage in risky behaviors. And with that, we need to aim to minimize the negative consequences of those behaviors instead of solely focusing on stopping them. Um, that I know can be a lot for some people to come to terms with because for many people, you don't, we've seen all of this education that has come out about how dangerous drugs are. But what we're learning through research is that drugs oftentimes are as dangerous as we make them. And by increasing prohibition and harsh sentencing, that's what's leading to newer, stronger substances that are coming out. The philosophy of harm reduction is focusing on public health and human rights rather than punitive measures. So if you're interested in criminal legal reform, harm reduction is so deeply intertwined with mass incarceration in the United States. And we're seeing, incarceration rates related to drugs rising. And that's going to continue to rise as we start to see really harsh penalties coming for fentanyl and fentanyl additives such as xylazine and whatever it is that comes next. All right, so key harm reduction strategies. So these strategies that are listed here are specifically related to harm reduction in relation to drugs. So that's like needle exchange programs. That gives people the ability to have clean needles. And for some people, I just, as I dive into these, I want to note that oftentimes there will be opposing viewpoints that this enables people. Me personally, I was using drugs before needle exchange programs had really caught steam. And it was because of that, my inability to get needles didn't stop me from using. Um, it just meant I used dirty needles, which is how I contracted hepatitis C. And that's been a many-year journey to get curative medication for that. I think that it's always important to note that when somebody is deep in like chaotic substance use, they're going to use regardless. So we might as well make it as safe as possible. And then also looking at it from an autonomy angle, not everyone who uses substances does so problematically. And adults should be able to make an educated, informed decision on whether or not substances are something that they want to use. So supervised injection sites, that is a safe place where someone can use. They have access to safe, clean needles, clean cookers if they're an injection user, and they're able to have medical care if they do overdose. Medication for opioid use disorder, MAT, I think, that could be like Suboxone or Vivitrol or methadone. It can be any of those medications that are used for opioid use disorder. And then decriminalization, legalization. Putting people in prison is essentially warehousing them. That doesn't help somebody who is dealing with trauma or somebody who is just a recreational user. It just takes, hundreds of thousands, millions of dollars a year from taxpayers to keep people warehoused and doesn't really do anything to help solve the problem. All right. So before I dive into the global examples of harm reduction, I did just also want to touch very quickly that harm reduction doesn't only apply to drug use. It also has many applications in the sex worker industry, access to STD and STI testing, access to contraceptives and, condoms, whatever is it that, worker would need. And also, it even includes things such as housing, people's ability to get housing. It's really such a broad topic, and we could go into so much of it. But I did just want to make that note. So global examples of harm reduction. The United States is not unique in the fact that it's having an overdose crisis. I think a lot of people, you know, aren't necessarily aware of what's going on in other countries or what has gone on historically in other countries. So it's really easy to look at the overdose crisis and think, oh my gosh, like this is new. How are we going to solve this? No one's ever been through it before. But that isn't really the case. I'll start with Switzerland. So Switzerland and a few other European countries actually had an opioid overdose crisis significantly before we did, and it happened in the 1990s. And rather than going a punitive route, they actually went and implemented supervised injection sites, heroin-assisted treatment, and essentially giving people access to safe supply. So in doing that, they didn't see the same kind of waterfall effect or domino effect like we have in the US, where one substance is being criminalized so people find the next thing. But they were able to essentially, completely cut out their overdose crisis, put an end to the overdose crisis by giving people access to safe supply of clean, regulated, government regulated drugs. And in doing that, they've reduced overdoses and their crime rates just skyrocketed down. Portugal, that's the one that I think people probably hear about the most. They criminalized all drugs in 2001. So they focus on treatment, harm reduction, and they've had incredible success rates. I don't know how small that little thing is there for you, but like their HIV is essentially non-existent with relation to drugs. Overdoses are essentially non-existent. Of course, there's a very small number, but comparatively, it's quite shocking. And then the incarceration rates also have shot down. When people are not put in situations where they feel that they're in survival mode, they're significantly less likely to commit crime. I know that all of my crimes that landed me in prison, I remember all of those days very clearly, and it was because I felt I had no other option. So that's why, we can look at what's worked and use that to shape policy that works in the future in the US. All right, pop quiz. So this is a multiple choice, and it's which of the following is considered a harm reduction strategy for substance use? A, incarceration, B, syringe exchange programs, C, zero tolerance policies, or D, mandatory minimum sentences. All right. So the majority of people answered correctly, which is the syringe exchange programs. Incarceration, zero tolerance policies, and mandatory minimum sentences contribute to mass incarceration, and they don't really acknowledge any of the reasons why people are problematically using substances in the first place. And it also, ends up incarcerating people who don't have substance use disorders. So benefits of harm reduction. There are so many that it would take a million years to list all of them. But first and foremost, improve public health. I would take a wild guess, that the majority of people on this call have either lost someone very close to them, overdosed yourself, or somebody who has overdosed. At this point, with the numbers in this country, there really is an overdose crisis, and through harm reduction strategies, we can save countless lives. We also have, issues such as HIV, hepatitis. We're seeing syphilis numbers rising, and tuberculosis, and those are all attributed in some way to people not having access to what they need while using drugs. Economic efficiency, I touched on this before, it is extremely costly to house people in prison. And the majority of people who are in prison don't have access to treatment anyways. So even if somebody was incarcerated and they have, problematic substance use, they want to seek treatment, the majority of prisons in the United States don't offer that. So it's essentially being warehoused with no help. And there certainly isn't access to, any quality level mental health treatment. And then enhanced social outcomes. So people who use drugs are part of our communities. Whether people like it or not, people have used drugs since the beginning of time. It's documented going literally back to the original documentation that humans were creating. Drug use has been around, it will continue to be around. And it's best if we reduce those harms, and we can ensure that people who use drugs are still, working and have access to healthcare and are part of our communities, because community is important. especially as things become, unstable, people don't have access to housing, things like that. Like it's so important to have strong communities, and harm reduction is something that really holds that as a core value, is community and being there for our people. There was a post on LinkedIn a couple days ago by Savage Sisters. They're located in Kensington and they do harm reduction services. And one of the things was, these people are going to come home, and they're either going to come home to, lovely or loving homes, families, and communities that care for them, or they're going to come home in a box. And that's very, very true. Um, and now there's no better time than now to ensure that those who use drugs are safe, because they are people. They don't deserve to be stigmatized. And I think if we come together, we can all really fight to work to ensure that everybody has rights in this country. Challenges and criticisms, we deal with this often. Political resistance. So there's a lot of opposition from those who favor punitive approaches. And there are many different reasons for this. A huge one is just lack of education. I found that while talking to congressmen and state legislators, is that there are a lot of people that are pushing punitive measures. So they're hearing all of this coming in, all this chatter from the opposition, but they're not really educated on harm reduction practices, or they're not seeing the research. So there's a lot of push. And then we also have a lot of politicians who are still in office that were involved in creating these harsh policies in the first place. So that's kind of a big thing for someone to have to come and say, wow, we really screwed this up. And then there are also other ties, like, those large incarceration numbers are building our cities. When America was built, it was built by slaves that were brought to this country. And when slavery was made illegal, we have in our Constitution that it's illegal except in cases of, incarceration. So our country is still essentially being ran and built by people who are indentured servants. So that is another thing. We've had directors of corrections who've come out and openly said, we can't lose our cheap labor because we wouldn't have the budget to run a lot of the things in our cities. And we can't allow people to continue to be incarcerated just because they need cheap labor. Implementation barriers. This is a really big one, and we saw it in Oregon. There was, decriminalization efforts in Oregon, and a lot of people were upset because they felt that it didn't work. But within that legislation, there were key pieces that would have needed to be implemented at the same time that for some reason were pushed out 3 years, like 3 to 5 years, I believe. So it's going to take a lot of like acceptance, infrastructure, and people working on it to ensure that we have like the right pieces of the puzzle in at the right time, because just fixing one piece isn't going to fix the whole problem. And then stigma. People have been drilled with, things like DARE and the faces of meth use and things like that over time. And when people have only received this kind of fear-based propaganda, there becomes a lot of misconceptions, and it's really hard to reel that back. And then there's also a lot of emotion involved in it. Those of us who have lost people to overdoses, or if you've been a victim of crime, I know that sometimes, it can be really easy to focus on that one thing. Obviously a person who uses drugs, I am also a victim of a violent crime, which you'll read about if you read my blog. And it's taken a lot to kind of move past that. I was someone who used to have like a very punitive view of drug use because of some of my younger experiences. I always say that I was kind of meant to become someone who uses drugs, because it showed me a whole nother angle. And I hope that I can kind of bring that view to other people and show everyone that, stigmatizing doesn't help. It just isolates people further.